name is Dr. Connie Cashen, and I'm really happy to be here to tell you a little bit about my profession, general surgery, how I got into it, why I love it. I've been doing it for almost 40 years, so it's obviously something that can keep you engaged. So I'm going to start out by telling you right off, I did not know I wanted to be a doctor. That was never something I planned to be. I went to college thinking I was going to work in computers or maybe be a teacher. And it was because of a insightful professor who suggested to me, well, maybe you should consider medicine. And it was like somebody turned on the light and I knew this was going to be my profession. At that time, I didn't know I wanted to be a surgeon. I was enamored of and admired my family doctor. And also, my father's best friend was a family physician. So I thought that's what I want to be. What a great place to get to know people over time, to be of service to them, to see them when they're young, to watch them grow up and have their families. So that was of great interest to me. When I went to medical school, I chose osteopathic medical school, and that was partly because its emphasis was on preparing people for primary care, and that's what I wanted to do at that time. When I got further in my training, I became very interested in the technical challenge of surgery, the amazing knowledge base of general surgery, the wonderful surgeons that I worked with inspired me, and so I chose that as my specialty and have stayed in that since I graduated from my residency in 1984. So, what are some of the things that are required if medicine is something you are considering? It is a long training journey. Uh, I enjoyed my entire training journey, but it is a long one. It does require that you complete 4 years of college, so you need to have a bachelor's degree. Many applicants for medical school have more advanced degrees. Then you have to go through medical school, which is 4 years. During that time, you are trying to make up your mind what field you want to go into so that you can excel in the areas that those programs would be looking for. Then, if you get into general surgery, you will spend 5 years in your general surgery training. Many residents after that will go on to do additional training of 1 to 2, sometimes more years so that they are now a subspecialty surgeon. So it is kind of a long training process. During that time, however, I will tell you, you make lifelong friends. You get to work in situations which are critically important for the patients that you care for. You see yourself advancing in your knowledge and your technical ability and the ability to actually help people in these sometimes emergency, serious situations. And all of that is extremely, extremely rewarding. Now, I do have some questions that I'm going to kind of refer to make sure I cover everything. So if I glance down a little bit, that's what I'm intending to do there. So the next thing I'd like to say is if you are in college and medicine is something you are interested in, what should you be doing? Really, the important thing is to study hard. You need to have a grade point average that is around 3.5 and preferably higher. You need to score a strong score on your MCATs. Right now, probably you need to be over 505 with kind of a balanced profile across the 4 different areas. To be really competitive, you need to be above 515. There are many, many medical schools in our country, and some are more interested in primary care. Some are highly interested in creating academic physicians who will do research and stay in the academic university setting. So there's a difference in terms of what are the qualities that people are looking for. But in addition to having the academic qualifications, you want to have a balanced portfolio. That means that things like competitive sports will be looked at extremely favorably. Strong leadership positions in organizations where it's important that whatever is the deliverable for that organization, you were the one responsible and you made it happen. Service work, both in the country and abroad, will definitely be looked at positively. In some places, there's even the recommendation that you take a year off after college and spend that doing service activity to build your portfolio and strengthen your application. That's not true for all schools, but some do recommend that. Being competitive not only in sports but perhaps in music. So if you play an instrument at a high level, these are all things that add to the sense that you are very capable of accomplishing what you need to accomplish in medical school. So those are the little tips I have if you are at the college level looking to see if medicine would be for you. Once you are in medical school, then you start deciding, is surgery for you? And part of that you learn by shadowing physicians. Part of that you learn by being on rotations. That's how I learned it. As I told you, my intention was to be a family physician. And when I got to my clinical rotations in the hospital and I saw the amazing things that surgeons did, how they could take a patient who was acutely ill with appendicitis, take the appendix out, and that person was well and ready to go home the next day. That was amazing to me. That they could remove cancer from people's bodies. That was amazing to me. So I actually found that I had natural technical ability. And it was easy for me then to pursue that as my field. So, what things do you need to do now in order to get into surgery? And I have a particular bias in this because I am a program director. So, I've been a practicing general surgeon since 1984. But in the last 10 years, I have directed a surgical residency training young physicians to be safe, active, practicing general surgeons, or to go on and get additional training for a specialty interest that they have, like vascular surgery or trauma surgery. So, what I look for when someone is applying to my program um, is very specific. It's not the same with all residency programs. My program is what's called a community-based program. So it's not a extremely large program in a university-based hospital program. It's a smaller 15 residents based out of a tertiary care center in a pretty good sized city. The first thing are your academic qualifications. So how well did you do in medical school, and are you in the upper half of your class, ideally in the upper quarter of your class? Then how did you do on your examinations? So whether it's the USMLE or the COMLEX, there are average scores that we see. So if you are USMLE, it's generally 240 and over is considered very competitive. If it's COMLEX, over 600 is considered very competitive. So those are things to think about while you are in medical school. Being strong in sciences as you came out of your college years is helpful, but not mandatory. Certainly, if you have excelled in anatomy, if you have been an assistant in an anatomy lab, the bedrock of good surgery is understanding the anatomy of the body. So if you clearly have that experience in your portfolio, that speaks well. Similarly, doing service work is very important, and depending upon the kind of program you want to go into, and certainly if you are looking at a university-based program, research is very important, and you need to be involved in that as a medical student. You get into the residency, so now you have 5 years ahead of you. How do you succeed as a surgical resident? Well, you have to have a lot of stamina. You work long, long hours. Surgery programs are probably some of the most time demanding. We have a limit of 80 hours a week that you can be actively working in the hospital. But in many cases, on certain rotations, you are working every one of those 80 hours. So having that kind of stamina where you can work, for, you know, 26 hours at a time is really important. Also being a very self-directed type of learner so that you are looking for opportunities to learn the things that you need to learn, both medical knowledge wise and technically. You need to be the one who has the initiative there. This is generally a surgery that you're doing so many different things. You're on the hospital wards taking care of patients. You're in the operating room doing surgery. You're on the floors doing procedures. You're in the clinic evaluating patients. You're going to the emergency room for uh, sick patients and trauma patients. So there are so many different things that you do that you need to be the one who is using all of those activities to further your knowledge base, given the guidelines that your faculty will provide for you, and given the structured education that does occur, but the majority is still dependent on you. Develop lifelong habits of learning. Reading every day, even if it's only 10 or 15 minutes. There is so much to know in medicine, and it is constantly growing and changing. There is no way that at the end of medical school you know everything you will need to know to be a good surgeon. So, developing that hunger for knowledge and continuing to study every day, not only will it help you learn what you need to learn to be a surgeon, but it's what's necessary for you to stay a safe surgeon. One of the things we have in residency programs is simulation, so you get to have ways of practicing how to do procedures, how to do surgeries before you would be allowed to start to perform surgery. So I recommend know the steps of all the common surgeries, practice them in a simulation setting so that when you are first at the operative table, number one, you're a very good assistant. Being a good assistant helps we as faculty to know that you're actually ready to start doing a procedure. So that I think is a great strength that is available. Take advantage of whatever types of simulation programs you have in your residency. So really good communication. Communication skills are critical. They're critical because as a surgeon, you can't accomplish what you need to without a team. You need your team in surgery. You are the captain of the ship, but you cannot guide that patient through a safe surgery without competent people helping you. Your scrub tech, the circulating nurse, the assistant, the anesthesia team. All of these people are critical to having a safe, happy outcome for the surgeries that you start. The only way you do that is with good communication. So you will have the opportunity to train in communication skills. Take every opportunity to do that. Sadly, it's a little bit overlooked, the importance of communication and teamwork and how to um, empower your team and how to support other caregivers who are on your team. All of these things are critically important to be a successful surgeon. With that, and underlying all of really good communication is a deep sense of respect for all of those that you care for and all of those that you work with. And I would impart to you, if you have a strong sense of respect for those that you care for and those that you work with, that alone will be a wonderful stimulus to you to make the right decisions, move your team in the right direction, whether this is in the operating room or this is on the floor talking to patients in the clinic, in their hospital rooms. I have always been trained and firmly believe that my patients are like my family. And so I would never recommend anything to them that I would not recommend to my own family. And that kind of spirit, as you work with your patients, engenders their respect, their gratitude. I've been on the other side of that, and I guarantee you that that's really true. There is nothing more reassuring to a patient and their family in a dangerous health situation than to know you can trust your physician to do the best thing for you. Not necessarily that it's going to be a perfect outcome, but that they tried everything they could to get the best outcome they could for you or your family. And at all times, they were there if you needed them, if you had a question. So I would urge you, if that resonates for you, medicine and surgery would be a wonderful field for you. How about getting along in the tough times? So this is something that you will encounter a lot in surgical training. Support is critical. You can't do it alone. People who opt to go into surgery frequently are very strong personalities who think they can and should be able to do it alone. But medicine is too complex, and there are wonderful people around you. You don't need to do it alone, and you'll do a better job if you're not alone. So I recommend knowing who in your residency class are your friends that you can lean on. Find a mentor in the faculty, an attending that you can look up to and you can call, so that things that may seem overwhelming to you, but they know, hey, I went through it, you're going to be fine. Let's talk about it. Somebody like that. A senior resident who can say, yep, this is part of what you got to go through, and everything doesn't always go your way, but let's step back. Let's just look at it and see, could you have done better? Or did you do the best that you could? We can always be better, but that senior resident who you know has been in your shoes very, very recently sometimes can be the greatest support to you. Your family, close friends, they don't have to be in medicine to be able to give you support and to reinforce that you're a wonderful, dedicated person who is really working hard in a challenging situation to get your education and do as best as you can by the patients you care for. That can be extremely supportive and also helps you to take the bigger picture. There's more to life than medicine, and sometimes it takes close friends and family to remind us of that. Similarly, think about work-life balance. Think about having other things in your life. Things like sports. Don't neglect exercise, nature, music, things like this, yoga, that can take you away from, your dedicated work and dedicated learning and training, to just realize that you're an amazing person to be as dedicated as you are, and you deserve to be well yourself. And these things will help you with that. Also, don't ignore your spiritual, contemplative self. Whether it's a religious practice, a church, meditation, these things really help to support people. One of the most effective ways of decreasing burnout for physicians and really everyone is mindfulness. So practicing mindfulness and meditation, these things will also help you to cope with the complex world of medicine and surgery. So in closing, I would just tell you it is one of the most rewarding professions in the world. It has any number of challenges. It's a long road. I didn't mention that there's a lot of debt associated with it. It's not uncommon for residents to complete their residency and have $200,000 worth of debt. We all know that education in every field now generally leaves the student with a debt load, and that is also true in medicine and surgery. However, you also have strong earning capacity. So for the hard work that you will continue to do, because you will never be a 9 to 5 person if you go into general surgery. You will be busy at night, you will be busy into the evenings, you will be starting early. This is very common for general surgeons. But those rewards are there financially. But for me, certainly the most important reward is the, the trust of your patient, the gratitude of your patient, knowing you did a technically excellent surgery for them, knowing that you used the best of medical knowledge on their behalf. That's the greatest reward. So thank you for your attention. Best of luck to you in making your choices and moving through your career path.